Hello and welcome back to the Gluten Free RN podcast. I'm Nadine, the Gluten Free RN. Today during episode 58, I am going to discuss mental health disorders and celiac disease. Stay tuned. Hello and welcome back. I am Nadine, the Gluten Free RN. Today during episode 58, I'm going to talk about mental health disorders and celiac disease. Just this past week, I had a meeting in a coffee shop with a woman, and she told me the story of a coworker of hers that was always cranky, mean, angry, irritable, and hard to work with, let alone hard to get along with. This poor woman finally got a diagnosis of celiac disease, and now she's a new person. Her life has changed, and she is no longer cranky, mean, irritable, and hard to work with. Her life is different now that she has a diagnosis of celiac disease. Ever since I started this, I have always said that anybody that is mean, nasty, irritable, cranky, angry should get tested for celiac disease. And I highly recommend that you suggest to people that have those somewhat annoying traits get tested for celiac disease. There's a number of reasons that these people may be suffering, and one of those reasons is that they have celiac disease that is undiagnosed. Interestingly enough, if you have a leaky gut or increased permeability of your intestinal wall due to damage from eating gluten, which is wheat, barley, rye, and contaminated oats, then there's a good chance that you also have a leaky blood-brain barrier, leaky lungs, leaky skin, and leaky blood vessels. All of this tissue is epithelial tissue. And if you do have a leaky blood-brain barrier, those long-chain amino acid gluten protein is capable of crossing that blood-brain barrier. We, as medical professionals, have a hard time making medicines that cross the blood-brain barrier. In the emergency department, we did have mannitol, which we used on severely head-injured patients to decrease their intracranial pressure. But that really was the only medication that we used in the emergency department that we knew that was capable of crossing that blood-brain barrier. But here, in the instance of undiagnosed celiac disease, we have a protein that is very capable of crossing that blood-brain barrier, in which case that protein or that long-chain amino acid protein, gluten, can cause hypoxia and inflammation of the brain. Is that ever a good idea? I would suggest that perhaps inflammation and hypoxia or decreased oxygen flow of your brain is not a great idea at all. But once people start on a gluten-free diet, after they're diagnosed with celiac disease or non-celiac gluten sensitivity, the nice thing is that as their guts heal and as they start to absorb nutrients appropriately, that blood-brain barrier will heal up also. At some point, there is damage that can be done that we cannot reverse, but everyone should have that opportunity to try to heal their body and allow their brain to heal. As you all know, I am a huge advocate of doing a mass screening of the entire population, or just considering adopting a gluten-free lifestyle or some variation of a paleo lifestyle, essentially eating whole foods. Several of the populations that I have discussed in the past getting tested for celiac disease sooner than later include people that are in prison, the homeless population, anybody in rehab for any drug abuse or alcohol abuse or any addiction, and people that are being treated for mental health disorders. That's a huge population, by the way. It's estimated that 50% of the population of the United States are on some type of psychotropic medication. So over the years, after many consultations with people, there seems to be a common thread. Not necessarily with everyone, but definitely frequent complaints of depression, anxiety, fatigue, paranoia, sadness, isolation, difficulty focusing, memory difficulties, suicidal ideations. A few of my clients have had a family history of suicide events where a family member has actually committed suicide. Is there a relationship? For some of these people, they'll never know if that family member that did commit suicide actually had undiagnosed celiac. or non-celiac gluten sensitivity. So many of my clients complain of difficulty sleeping, mood disorders, personality disorders, and really almost 100% of my people have brain fog. They complain of it at some point. Headaches, seizure disorders, failure to cope, negative thinking, and the list goes on and on. If you have undiagnosed celiac disease, we know that you have malabsorption of nutrients, especially your B vitamins, vitamin D3, and essential fatty acids. You have a damaged immune system, and celiac disease is primarily neurological, despite the fact that it falls under the auspices of the gastroenterologists. All neurologists should be very aware that celiac disease is primarily a neurological disorder. People with undiagnosed celiac disease also suffer from hormonal imbalances, especially thyroid dysfunction, and also have neurotransmitter disruption due to the damage in the intestines. So serotonin, dopamine, melatonin levels are all disrupted. You can also reference some of the articles included in the show notes for episode 58 so that you too can begin researching some of the mental health disorders that go along with celiac disease and follow along as I read some of these interesting paragraphs in some of these really well-written articles. Let's look at the gluten sensitivity as a neurological illness article from Dr. Marios Hadjivasiliou, R.A. Grunwald, G.A.B. Davies-Jones, and this is an editorial. If you look over in the third row, the neurology of celiac disease, in 1966, Cook published a landmark paper on 16 patients with neurological disorders associated with adult CD, or celiac disease. This was the first systemic review of the subject after the introduction of diagnostic criteria for celiac disease. 10 of these patients had a severe progressive neuropathy, or numbness and tingling. All patients had gait ataxia, difficulty walking straight, and some had limb ataxia. Neuropathological data from postmortem examination showed extensive perivascular inflammation changes affecting both the central and peripheral nervous system. A striking feature was the loss of Purkinje cells with atrophy and gliosis of the cerebellum. All 16 patients had evidence of severe malabsorption, as evidenced by anemia and vitamin deficiencies, as well as profound weight loss. Several case reports followed, primarily based on patients with established celiac disease, often with persisting troublesome gastrointestinal symptoms followed by neurological dysfunction. Data from patients with celiac disease presenting with gastrointestinal symptoms followed up in a gastrointestinal clinic suggested that otherwise unexplained neurological dysfunction is a complication in 6 to 10% of cases. And if we skip to the conclusion of this editorial, entitled From Gut to Brain, gluten sensitivity is best defined as a state of heightened immunological responsiveness in genetically susceptible people. This definition does not imply bowel involvement. That gluten sensitivity is regarded as principally a disease of the small bowel is a historical misconception. Gluten sensitivity can be primarily, and at times exclusively, a neurological disease. The absence of an enteropathy should not preclude patients from treatment with a gluten-free diet. Early diagnosis and removal of the trigger factor by the introduction of a gluten-free diet is a promising therapeutic intervention. IgG anti-gliadin antibodies should be a part of the routine investigation of all patients with neurological dysfunction of obscure etiology, particularly patients with ataxia and peripheral neuropathy. So that's a great article, and I really do like this entire piece of work. It is thought-provoking, and it also points out the fact that the AGA, or the anti-gliadin antibody, is an excellent biomarker, if not for celiac disease, then potentially for non-celiac gluten sensitivity. And as this editorial points out, the damage doesn't necessarily take a long time to happen to the neurological system. There is a case in here that shows that there is an onset of cerebellar atrophy, which is brain shrinkage, that occurs over 15 months before the diagnosis of gluten ataxia. So that's actually brain shrinkage that is caused by ingesting or eating gluten. If I can prevent my brain from shrinking by strictly being on a gluten-free diet for the rest of my life, I will happily be on a gluten-free diet. I am not one that is looking for my brain to shrink either today or next week or next month or even as a 90-year-old. I want my brain to be as plumped up and fat as humanly possible. I want a big brain. There's another great article in the International Journal of Celiac Disease entitled Psychiatric Complications of Celiac Disease from 2014. Celiac disease can manifest as psychiatric disorders like depression, anxiety, or psychosis. Coincidence with eating disorders was also described. Usual proper diagnosis is performed secondary to psychiatric symptoms. In some cases, gluten-free diet can reduce or even resolve both gastrointestinal and psychiatric symptoms. Again, that gut-brain connection is so intertwined that in many cases, if you change a person's diet and if you put them on a gluten-free diet or some variation of a paleo diet, a whole food diet, then their symptoms resolve. There are many cases of people with schizophrenia or some type of mental health disorder, including autism, ADHD, learning disabilities, also complaining of gastrointestinal symptoms. Which comes first? The chicken or the egg? Which comes first? The intestinal damage or the intestinal symptoms or the symptoms of brain inflammation, difficulty focusing, depression, anxiety? It may be hard to tease out which comes first, but if people get better overall on a gluten-free diet with their gastrointestinal symptoms, which can be diarrhea, constipation, abdominal pain, bloating, and then also their neurological symptoms resolve, such as seizure disorders or headaches, mental health disorders such as bipolar, schizophrenia, anxiety, depression, then we need to be advocates for our patients and our family members for being on a gluten-free diet. It is not dangerous to be on a gluten-free diet or to change your diet in a way that potentially will allow you to resolve malabsorption disorders, improve your immune system, replace neurotransmitters, and allow your nervous system to heal. I do work with many people that have been diagnosed with schizophrenia, some older, some younger, and interestingly enough, most of the people that are tested for the HLA DQ2 and or DQ8 genes are gene positive. They also have a diagnosis of schizophrenia. So again, I would like to advocate for people with schizophrenia for testing for celiac disease proper and also for non-celiac gluten sensitivity. Since schizophrenia is such a life-changing diagnosis and also debilitating, there's no reason not to test everyone appropriately for celiac disease or non-celiac gluten sensitivity. If people get better on a gluten-free diet or a whole food diet, a high-fat, low-carbohydrate diet, whatever diet or lifestyle change helps them improve their quality of life, please make sure that your family members all have access to this information. Especially our children. There are many children that suffer from anxiety. In the United States, I can't tell you how many people of school age actually cannot attend school because they have such overwhelming anxiety. Why do they have anxiety? Is it social pressures? Is it potentially the impact that gluten or food products have on these kids' brains? We do need to get to the bottom of it. We need answers. And this potentially is an answer. If it's an answer for you or your family members, great. I am very happy that this information has reached you and you have an opportunity to make a lifestyle change that can impact your current or future mental health. And not just your mental health, but also your physical health and your emotional health. Trust me, most of us that have had experience with depression or anxiety, brain fog, it is very difficult to function as a normal human being, whatever that means. It's hard to be productive. It's hard to get work done in a very consistent manner. These symptoms can be overwhelmingly distracting and debilitating. So once again, I'm advocating for people to get tested for non-celiac gluten sensitivity, and celiac disease so that they have an opportunity to potentially get better and improve their mental health status. Many people report that their lives are better, that they're happier, that brain fog is gone, that they can go back to school, learn, and their life is improved immensely. And while they're sad that it took so long to get diagnosed, they are grateful that they do finally have this diagnosis or this opportunity to feel better. Whether they have celiac disease or non-celiac gluten sensitivity, this should be considered a clinical trial for just about anyone that suffers from any mental health disorder, including bipolar, schizophrenia, anxiety, depression, seizure disorders, headaches, difficulty sleeping, personality disorders, or, of course, all those people that are cranky, mean, angry, irritable. If people have an opportunity to get better or get their brain back, let's try it. There's no downside. Let's help people get their intestines healed, heal up that leaky gut, heal up that leaky blood-brain barrier, get rid of the inflammation in their bodies, heal up that damaged immune system, and deal with any hormonal imbalances or thyroid dysfunction. People will sleep better, they'll feel better, they'll enjoy their lives, they'll laugh more. They won't need as much medication or medication at all. Food is medicine, and it is very potent and powerful. If people are consuming a protein that our bodies read as toxic or a poison, then we need to be aware of that information and be able to remove that toxic protein from our diet, because that toxic protein is potentially causing many physical and mental health disorders. Once again, I'd like to thank everyone for listening to the Gluten Free RN podcast. This is a large topic, once again, mental health disorders and celiac disease, episode 58. Thanks for going along with me on this very interesting journey. With any luck, someone will listen to this podcast and it will help them. It will help you or your family or your friends regain the quality of life that you deserve. Thanks again to Tim Hallowell and the podcasting group who are responsible for producing and editing the Gluten Free RN podcast. A huge shout out to the Pulse Media Network, a group of fellow nurse podcasters that are very supportive and instrumental in helping me establish the Gluten Free RN podcast. Thank you so much for listening, wherever you are in the world. Good luck in finding all of the physical and mental health that you deserve. If you've enjoyed this podcast or any of the other podcasts from the Gluten Free RN, please leave a review and a rating on iTunes, Stitcher, Google Play, or wherever you listen to the Gluten Free RN podcast. You can also purchase my book, Donation, on Amazon.com, any local independent bookstore, Barnes & Noble, or wherever you get books. If it's not already at your library, request that they carry a copy. Donation, a nurse's memoir of celiac disease from missed diagnosis to food and health activism. Thanks again for joining me, Nadine Gruskowiak, the Gluten Free RN, for episode 58. Until next episode, stay healthy, eat well, and be happy. Bye.